My name is Laha Alizada, and today our presentation is about Native Americans. In this presentation, we will be discussing specific aspects of the culture, nursing implications, and ethical consideration, and how to provide culturally competent or culturally sensitive care. Before we go into more details about the Native Americans, I'm going to just give a real quick background about them. So Native Americans used to live in America way before Columbus or any of the Europeans came into America. They are also referred to as Indians or Native Indians because when Columbus first came into America, he thought that he sailed into the country of India, so the name kind of stuck with them for a while. Native Americans used to live in South and mostly in North America. They also used to live in tribes, depending on which area they were living in, so that they could preserve their culture and preserve their religion. Next, Ms. Jennifer, she'll be talking about the culture of the Native Americans.
Hi, my name is Jennifer Jones, and I'm going to tell you a little bit about the cultural aspects of Native Americans. First of all, their geographical location. They are located scattered all over North America, with the greatest populations being in California, Oklahoma, Arizona, and New Mexico. Many do live in the general public, however, a substantial amount still live on reservations. As far as physical characteristics, it does vary tribe to tribe. However, generally speaking, they have dark hair, dark eyes, almond-shaped eyes, heavy or fat eyelids, large earlobes, and what are known as shovel teeth. This means that their front teeth have a ridge on the backside that can be felt with the tongue. Family roles also differ tribe to tribe, but again, generally speaking, both sexes are involved in the decision making. Historically speaking, men are considered hunters and the women are the life givers, which means they are responsible for the welfare and survival of the family. In regards to healthcare, extended family does play a big role in Native Americans, and they do want their extended family involved. However, they do prefer to make their own decisions on healthcare. Native American healthcare beliefs are rooted in spirituality. They practice a culture of animism. This is considered, this is all natural objects in the universe are considered to have a soul or a spirit. This includes plants, animals, rocks, and even such natural phenomena as rainstorms and mountains. They have strong rituals and beliefs regarding childbearing and death. It is very important that we honor these rituals and beliefs in the healthcare setting. Stoicism is valued in labor and delivery. Most Native American women are going to ask to have a female relative present during birth. Following the birth of the child, the mother and baby will stay inside away from others for 20 days until the umbilical cord falls off. Once the umbilical cord falls off, the umbilical cord is kept for spiritual reasons. Death is looked at as entering into the spirit world. It's the beginning of their passage into the spirit world, so it is celebrated. Food, herbs, and gifts are left at graveside to ensure a safe passage into the spirit world. It is very important for Native Americans that their whole body is intact in order to enter the spirit world safely. Therefore, they may request that any body tissues be returned that were removed. This includes nail clippings, hair, amputated limbs, and organs. It is important to note that Native Americans are hesitant to speak about terminal illnesses or DNR status. They believe that speaking of this actually brings death quicker. The leading diseases and causes of death in the Native American community are suicide, heart disease, cancer, diabetes, liver disease, and hepatitis. And many of the contributing risk factors for these diseases are smoking tobacco, high alcohol intake, obesity, substance abuse, and mental health issues. Some important factors to note when considering Native American healthcare is their low income, cultural barriers, and geographical isolation. This makes it harder for them to receive quality medical care. Their attitudes, Native American attitudes towards healthcare, is deeply rooted in historical things that have happened. They are very hesitant to sign any medical documents because of their distrust of the white man. This stems from the breaking of treaties in the past. Native Americans do not feel that they should have to apply for Medicaid because they believe that medical care was promised to them from treaties in the past. They believe in a culture of fatalism. This is considered one's destiny is already predetermined and therefore it cannot be changed. Therefore, they're hesitant to follow any healthcare regimens because they believe that regardless of what humans do, they can't change the course of fate. So now Stacy is going to tell you a little bit more about the nursing implications involved while taking care of Native Americans.
Hi, I'm Stacy Williams, and I'm going to talk to you about nursing implications when caring for the American Indian patient. To provide culturally sensitive care, healthcare workers cannot stereotype patients. You can't assume that their first language is English. They may speak in their own native tongue. We need to make sure that we can communicate effectively by first checking to make sure that they do speak English. If not, we need to inquire about an interpreter. The next thing is we need to have some American Indians have known to not follow recommendations of Western medicine, and we need to, again, not assume that they're not going to be compliant. We need to give them, and every individual, the chance to know that they are willing to try the recommendations of the physician. If not, then maybe cooperating with their shaman would help their health care. The next thing is that we're going to talk about is demonstrating respect for their healthcare choices. For example, Navajo tribe members do not typically accept blood transfusions or donate organs. Coming from a medical perspective, we want to see patients do well. We want to see them, have a positive outcome. However, we really need to respect the fact that they've made an educated choice not to receive the blood transfusion or donate organs for their health care. We need to provide privacy with any culture, especially with a Native American Indians, because they are a very modest culture. The next thing we're going to talk about is communication. They communicate through verbal, touch, and indirect communication. The first step is verbal. Never interrupt one speaker. Or a speaker, one speaker at a time. Again, with Latinos, many cultures, interrupt each other and talk, and that's okay. With Native American Indians, it is seen as very rude to interrupt the speaker. When communicating in their culture, they want you to speak softly. It shows respect. If you raise your voice, it is very disrespectful. So when approaching them, make sure that you are speaking very softly. Next up is touch. Touch is generally reserved for family and friends, and no strangers. They view that as very odd, so they may not want to shake your hands or give hugs. If a handshake is approved by the patient, a very light handshake is generally done. A stern handshake is shown as dominance, which makes them fear the person more. So to build trust, make sure that you are giving a light handshake. Next up is indirect communication. In their culture, they prefer indirect eye contact, which shows respect. Also, they do not like when you ask them direct questions. If you have questions for the patient, they generally like the questions to be presented in a story mode. Basically, kind of tell a story and then ask questions in regards to the story. Silence is also a means of indirect communication, which shows respect in their culture as well. If asked a question, they may take some time before responding back. This is normal. Again, silence is a means of positive communication. Next, we're going to talk about health promotion education. We need to include common ailments known to the culture. As Jennifer had said, there are several ailments known to them. Two that I'm going to talk about are tobacco use, which is very common with the American Indians. Not only do they smoke cigarettes or cigars for pleasure, but they also use this in part of their healing practices. Educating them on the usage of tobacco and the harmful effects will help prevent known common ailments to their culture. The next is diabetes. Diabetes, unfortunately, is very prevalent in American Indians, so education on diet and exercise would help to prevent and manage their care. The next step is incorporating their cultural health rituals in teaching. To gain interest in the American Indians, since they don't seem to trust the white man or Western medicine, we need to incorporate rituals and blend them along with teaching materials. Having a shaman available and possibly even using some of their spiritual practices will help increase some of their interest in learning a little bit more about the Western medicine's ability to help them heal or prevent any sort of ailments. Next up is hosting educational classes within the reservations. American Indians do well when taught in groups. They don't feel isolated. So hosting educational classes on their reservations in their own land in group settings will also set up an environment where they will be able to grasp the information much better. Make sure that you're discussing the importance of adhering to medical regimens, even if they need to incorporate their own medical practices. Again, like I said, with the shaman, as long as it's deemed safe. Next, we're going to be talking about showing respect for their cultural beliefs. Make sure that we are respecting the patient's wishes. Be understanding if they are refusing a certain method of treatment. We need to make sure that they understand the importance of the treatment and the reason that we want to do it in a certain manner. We need to allow space for them when they are conducting ceremonies in the room. We need to make sure that we leave quietly and give them privacy. We need to limit interruptions, possibly put up a sign, or perhaps stay close to the room to stop, say, nutrition or environmental services from going in there and interrupting their ceremony. The next is that we need to provide an environment for the patient to practice their rituals, such as American Indian women who are birthing typically do not lay down on their back, but in their traditions, they kneel or squat when having their child. In the hospital, we need to make sure that we can provide this environment not only for the mother to practice their rituals, but we need to make sure that the child is also going to be safe. The next is Navajo women. When they are laboring, women chant or hold on to sacred items. We need to make sure that we are showing respect and allow them to carry out these rituals while they are in the hospital. By demonstrating cultural sensitivity and effective communication, we can gain trust with American Indian patients, allowing us to provide adequate health care in the patient's best interest. Next up is ethical considerations.
Hi, my name is Rabia Nazar and I'm going to talk about ethical considerations. Being a part of ethnic minority and immigrant population in United States, American Indians faces pressure to fit into their own culture and with the white culture. There has been evidence that biculturalism is strongly associated with substance abuse. So they use, the young generation especially, use more drugs and alcohol to cope with the culture. We have to talk, as a nurse, we have to communicate with our clients, give them open, let them talk about their culture. We have to learn about their culture, how they cope, and then that way we can help them. We have to know about their specific cultural elements. They believe in traditional healers. Some of them will prefer only their healing methods, which can cause harm. When they only choose non-traditional healers to involve, then we have to talk to them like what can happen if they only choose their traditional healers and not accepting the Western medication. We have to educate them about that, and we have to tell them about the resources available in the community so they can go and educate themselves. actually the dilemma or conflict arises when they only choose their only traditional healing methods. There is no written medications. They use herbals, spirituality. So some of the diseases which needs Western medication, if they decide to avoid those medications, then it can harm themselves. So we have to talk about them. We can see in they have distinct cultural stereotypes. They believe when they are in tribes, they are whole and balanced. So we have to keep in mind that and respect their own cultural traditions. That's how we can help them and avoid those conflicts. Next, we'll go to conclusion.
So in conclusion, today we have discussed the aspects of culture in Native Americans, nursing implications, and ethical considerations. In order to meet the expectations of the Native Americans, healthcare workers need to understand and integrate into treatment and procedure the beliefs of the patient's tribes. If we as RNs learn about most of people's cultural aspects, then we should be able to give them the best care possible. They don't expect for the nurses to be able to perform the rituals or traditional methods of healing, but they do at least expect the respect for their beliefs and the balance to be achieved between two cultures in the treatment.